Hello friends, welcome to my channel and let's see another topic जो एग्जाम पॉइंट ऑफ व्यू वेरी इंपॉर्टेंट है, मैमरी ग्लैंड और द ब्रेस्ट। जो भी टॉपिक्स मैं यहाँ पे कवर कर रहा हूँ उसमें मेरे एक बेसिक एम है कि आपको एक थरोली नॉलेज मिले उस टॉपिक के बारे में। फिर एग्ज़ाम में उस टॉपिक के बारे में कौन कौन सी शॉर्ट नोट्स पूछी जाती है, लॉन्ग क्वेश्चंस पूछे जाते हैं, कहाँ पे एमसीक्यू पूछे जाते हैं, कहाँ पे वाइवा पॉइंट ऑफ व्यू थिंग्स इम्पॉर्टेंट है। फिर आपको उस क्वेश्चन का आंसर जब पेपर में लिखते हो तो आपको किस तरह से आंसर लिखना है, कितने मिनिमम पॉइंट्स आपको लिखने हैं, ये सारा ओवरऑल अप्रोच है हर वीडियो में। तो इससे आपको एनाटॉमी में एक अच्छे मार्क्स मिल सकते हैं, पासिंग इजी तरह से हो सकता है। तो आपको ये बेसिक ओवरलाइन आपके लिए है कि आपको इन अप्रोच पे टॉपिक्स पे इस तरह से याद रखना है, ये मिनिमम पॉइंट्स उसमें याद रखने हैं और इस वीडियो के माध्यम से आपको नोट्स बनाने में भी आसानी मिल जाए, इस हिसाब से हर टॉपिक को कवर किया गया है। तो चलो लेट्स स्टार्ट टुडेज टॉपिक, मेमोरी ग्लैंड। अभी एनाटॉमी में कोई भी टॉपिक हमको जो पढ़ना है उसमें सबसे इम्पॉर्टेंट है व्हाई वी वांट टू रीड दिस टॉपिक, दैट इज़ वेरी इंपॉर्टेंट। ओके, in respect to the mammary gland, it is the most common cancer in female. तो दिस इज़ अ वेरी इंपॉर्टेंट थिंग। क्लिनिकल पॉइंट ऑफ व्यू ईच एंड एवरी टॉपिक में क्या इंपॉर्टेंट है कि ये मेमोरी ग्लैंड इज़ अ वेरी कॉमन एंड वन ऑफ द इट इज़ द मोस्ट कॉमन कैंसर इन फीमेल्स। सो फर्स्ट नंबर पे जो सबसे ज़्यादा नंबर ऑफ पेशेंट्स है कैंसर के, वो CA ब्रेस्ट है, कार्सिनोमा ऑफ ब्रेस्ट है, कार्सिनोमा ऑफ मेमोरी ग्लैंड है। दूसरी क्लिनिकल एंटिटी जो आती है ब्रेस्ट एब्सेसिस, विच इज़ वेरी कॉमन एट आफ्टर द डिलीवरी ऑफ द बेबी इन लैक्टेटिंग वुमन बिकॉज ऑफ द न्यूमरस रीजन्स, biting of these babies at the nipple, cracking of the nipple, syringe pump uses. Because of that, in chances of spread of infection is more common, that will lead to the breast abscess. In case of plastic surgeon, breast surgeries are most common, breast augmentation, breast reduction, like this cosmetological surgeries are more common. And nowadays, because of the food adulteration, there are increased level of estrogens in a male that will lead to the gynecomastia, that is the prominence of breast in case of male. That because of that, all this topic is very important from clinical practice. Then second thing, एग्जाम पॉइंट ऑफ व्यू, दिस इज़ वेरी इंपॉर्टेंट टॉपिक। इसमें बहुत बार लॉन्ग क्वेश्चन पूछा गया है ऑन द ग्रॉस एनाटॉमी ऑफ मेमोरी ग्लैंड। शॉर्ट नोट्स में लिम्फेटिक ड्रेनेज ऑफ द शॉर्ट नोट्स इज़ अ वेरी इंपॉर्टेंट टॉपिक एंड द क्लिनिकल क्वेश्चंस जो एक सेपरेट शॉर्ट नोट आती है क्लिनिकल क्वेश्चन की एंटिटी, उसमें कार्सिनोमा ऑफ ब्रेस्ट और उसके फीचर्स के बारे में भी क्वेश्चंस आते हैं। तो ये सारे टॉपिक्स क्वेश्चन से जो इस टॉपिक पे हमेशा पूछे जाते हैं और इसकी वजह से ये टॉपिक काफ़ी इम्पॉर्टेंट है। तो लेट्स स्टार्ट विद द कोर टॉपिक। नाउ व्हाट इज़ मेमोरी ग्लैंड? इट इज़ अ मॉडिफाइड स्वेट ग्लैंड। दिस थिंग इज आस्क इन द MCQ कि ये MCQ में पूछे जाते हैं अल्टरनेटिव्स में। तो मेमोरी ग्लैंड इज़ अ मॉडिफाइड स्वेट ग्लैंड। ओके, then where it is located? It is located in the pectoral region and mammary gland is present in both sexes, male and female. Okay, but it is rudimentary, not well developed in female and pubertal of age. After the puberty it gets well developed as an accessory sex organ and also it provides milk to the newborn. Okay, so दिस इज़ व्हाट द इंट्रोडक्शन ऑफ मेमोरी ग्लैंड। इनमें आपको याद रखना है मॉडिफाइड स्वेट ग्लैंड, ये MCQ और वाइवा में पूछा जाता है। द नेक्स्ट थिंग इज़ द वेयर इट इज़ लोकेटेड और व्हाट इज़ द लोकेशन ऑफ मेमोरी ग्लैंड। नाउ वेयर इट इज़ लोकेटेड, तो ये रहा नेक सुप्रास्टर्नल नॉच, ये रहा स्टर्नम, ये रहा आर्म, ये रहा एक्जिला। सो इट लोकेट्स फ्रॉम द सेकंड रिब टू द सिक्स्थ रिब वर्टिकली, सो दैट इज़ द एक्सटेंशन. It is located in the pectoral region and extends vertically from the second rib to the sixth rib and laterally or horizontally it extends from the lateral border of sternum to the mid-axillary line. So its extent is the vertically second to sixth rib, horizontally lateral border of sternum to mid-axillary line. The shape of the is a variable, but mostly it is a hemispherical or conical in shape. That is the shape and extent हो गया. Then in case of mammary gland, normally its a base is circular, but the part of from the base or the mammary gland, some part extends into the axilla. So axilla is the part between this arm and the chest wall, that is called as the armpit or axilla. So some part of the mammary gland extends into the axilla, and that is called as the axillary tail of Spence. And while it going to the axilla, it pierces the deep fascia of the pectoral region, and the opening in the deep fascia is known as a foramina of Langer. So foramina of Langer is also asked in the MCQ. Okay. So whole mammary gland is situated in superficial fascia. Okay, but it extends into the axilla by piercing a deep fascia, and that extension is called as axillary tail of Spence, and that fascia from which it passes, that opening or that foramina is called as the foramina of Langer, through which the tail of Spence passes. Then the what structures lies deep to the mammary gland? So in the pectoral region, if we remove the skin and the mammary gland, we see this pectoralis major muscle. Okay, then below it, from the rib side laterally, there is the serratus anterior, and towards the anterior abdominal wall, external oblique aponeurosis. These three muscles forms the deep relation. So deep to the mammary gland, there lies the pectoral fascia, and between it there lies pectoralis major, serratus anterior, and external oblique muscle. Now between this deep fascia and the mammary gland, so here is mammary gland, this is the pectoralis major, minor. Okay, and this is the clavipectoral fascia. So whatever the fascia, this covering over the pectoralis major is called as the deep fascia, and over it, this part is nothing but the retromammary space. Retro means behind mammary gland, so that is called as retromammary space, which lies behind the mammary gland. So this retromammary space is nothing but the space between the breast and the pectoral fascia, and this retromammary space is made up of loose areolar tissue, and because of this loose areolar tissue, it gives mobility to the mammary gland. So that lies over there, and it gives the mobility or freely mobile mammary gland over the chest wall. Now in case of tumor, if that is extending or going deep to this deep fascia, that lump or swelling get adherent to the deeper tissue, and it is not freely mobile, and that is one of the characteristic of the carcinoma or the malignant tumor of the mammary gland or carcinoma of the breast. Okay, what is the structure? Now till now we have seen what is the extent, where the mammary gland is located, which is a type of gland. Okay, it is modified sweat gland. What are the deep relation, what is loose, what is retromammary space and its importance. Now the next is the structure of the mammary gland. Mammary gland is made up of three things: a outer covering, that is called as the skin. Beneath the skin there is a stroma or the supporting framework of the mammary gland, and the parenchyma is nothing but the glandular part of the mammary gland. So mammary gland नेम में उसमें ग्लैंडुलर पार्ट है, दैट इज कॉल्ड एज पैरेंकेमा. फिर ऊपर की स्किन है, एंड स्किन के नीचे जो भी कुछ फ्रेमवर्क है, जो स्ट्रक्चर है, दैट इज कॉल्ड एज स्ट्रोमा. अब स्किन में भी दो चीज़ें आती है. स्किन में एक स्किन एंड स्पेशलाइज पार्ट ऑफ द स्किन इज कॉल्ड एज निपल एंड एरियोला. स्ट्रोमा में आता है फाइब्रस टिश्यू और फाइब्रस बैंड एंड द फैट, and parenchyma होता है glandular tissue, that is the lobes of the mammary gland which consists of lactiferous duct and acini. Okay, that comes into the parenchyma. One by one, first skin component. Skin of the mammary gland is having a one special feature called as a nipple. This part is called as a nipple. Nipple is nothing but it is a conical projection from the mammary gland or over the skin. Over the skin there is a conical projection. It's just like beneath the center of the mammary gland and located just below the center at the fourth intercostal space about 10 centimeter midline from the body. So it is located just below the center of the mammary gland in the fourth intercostal space. So ये sternum है, यहाँ पे सेकंड रिब अटैच रहती है, देन देर इज थर्ड, फोर्थ, फिफ्थ, सिक्स्थ. ओके, एंड लाइक दिस रिब्स आर देयर, and whatever between the ribs, this space is called as the intercostal space. So mammary gland is situated into the fourth intercostal space 10 centimeter away from the midline, just like beneath the center of the mammary gland. Nipple is nothing but the conical projection, and this nipple is pierced by these ducts. ये जो पिंक कलर के दिख रहे हैं यहाँ पे, these ducts, these are called as a lactiferous duct, and it is pierced by 15 to 20 lactiferous duct. That's over the nipple. Now areola. एरियोला, ये जो निप्पल है इतना ये वाला, इसके अराउंड का ये जो डार्कली पिगमेंटेड एरिया है, दैट इज कॉल्ड एज अ एरियोला. सो इट इज़ अ सर्कुलर पिगमेंटेड एरिया विच सराउंड्स द निप्पल. ऑन दिस इज निप्पल and this is surrounded area. This is called as a areola, and this is the breast tissue. Okay, so it has a numerous modified sebaceous gland which produce the oily secretions. Okay, these oily secretions are necessary to prevent the cracking of the nipple. Skin over the nipple and areola do not have hair follicles, so they are not having hair follicles, and the skin of the areola becomes more dark pigmented at the time of the pregnancy. So that is about the areola. Okay, तो हमने स्किन देखा. स्किन में दो फीचर्स है, निप्पल एंड एरियोला. निप्पल क्या रहता है, कहाँ पे लोकेटेड है, और निप्पल के अंदर क्या है. फिर एरियोला देखा. एरियोला कैसे है, सर्कुलर है, डार्कली पिगमेंटेड एरिया है, वहाँ पे सिबेशियस ग्लैंड है, उसका फंक्शन देखा. ओके, नाउ द नेक्स्ट स्ट्रक्चर ऑफ द मैमरी ग्लैंड इज अ स्ट्रोमा. स्ट्रोमा में क्या आता है, सपोर्टिंग फ्रेमवर्क. उसमें दो चीज़ें आते हैं जिससे मैमरी ग्लैंड बनाए. बल्क, एक इज़ द फैट, मेन इज कंटेंट इज द फैट दैट फॉर्म्स द बल्क ऑफ द मैमरी ग्लैंड, एंड दूसरा आता है लिगामेंट, सस्पेंसरी लिगामेंट. सो इट कंसिस्ट ऑफ फाइब्रस टिश्यू एंड द फैट. द सस्पेंसरी लिगामेंट ऑफ द कूपर. व्हाट इज सस्पेंसरी लिगामेंट ऑफ कूपर? द फाइब्रस टिश्यू सेप्टा दैट एक्सटेंड्स फ्रॉम, अगर ये स्किन है ऊपर की मैमरी ग्लैंड की, फ्रॉम द स्किन टुवर्ड्स द डीपर टिश्यू और डीपर फेशिया, देयर गोज द ligaments. These are called as the fibrous septa or strap that extends from the skin to the deeper tissue, and their main function is it maintains the shape of the breast, gives the contour to the breast. Okay, that is the main content, and second content is the fat which forms the main bulk. Okay, तो ये रही ग्रीन कलर के जो फाइबर्स है, these are called as ligament of Cooper. So this ligament of Cooper connects the skin towards the deeper tissue, and these ligaments are called as suspensory ligament. In between this ligament there lies the adipose tissue or the fat that forms the main bulk of the mammary gland. Okay, so that is the second structure. Skin हो गया, फिर हमने देखा स्ट्रोमा देखा, स्ट्रोमा में फाइब्रस टिश्यू एंड फैट देखा. नेक्स्ट स्ट्रक्चर इज द पैरेंकाइमा, दैट इज नथिंग बट द ग्लैंडुलर टिश्यू ऑफ द मैमरी ग्लैंड. So mammary gland is formed by this glandular tissue which has nothing but the modified sweat gland. So this glandular tissue is arranged into a different lobes. Mammary gland consists of 15 to 20 lobes. They are arranged circularly like a spoke of the wheel. तो ये बीच में निपल है, ये एरियोला है, and these are the glands situated. Lobes are situated like this, like a spoke of the wheels. Okay, so it consists of 15 to 20 lobes. अब ये रहे सारे lobes, ये पिंक कलर वाले, and they all lobes opens over the area nipple. Okay, what it contains the lobe? Lobe consists of one lactiferous duct. ये जो सेंट्रल में lactiferous duct है, and there are the numerous acinus opens into the lactiferous duct. These acinus have the production of the milk, and these milk secretions are carried by this lactiferous duct towards the surface or towards the nipple, and at the nipple there are 15 to 20 openings of the lactiferous duct. Just before opening the lactiferous duct at the nipple, beneath the areola there occurs the dilatation over the lactiferous duct, and this dilatation is called as a lactiferous sinus. This sinus is act as a temporary storage of the milk. सो स्ट्रक्चर में देखा हमने, एसिनस इज द ग्लैंडुलर टिश्यू, वो बनता है लोब से, देयर आर 15 to 20 लोब्स, ईच लोब में एक लैक्टिफेरस डक्ट है, फिर कुछ एसिना है, फिर लैक्टिफेरस साइनस है, एंड दैट डक्ट ओपन्स एट द निप्पल. सो दैट कम्स टू द स्ट्रक्चर ऑफ द मैमरी ग्लैंड. Then the next important is the blood supply of the gland, mammary gland. There are the vessels which supplying the mammary gland. So first ये स्टर्नम है यहाँ पे, ओके. ये स्टर्नम के पीछे जो एक मेन आर्टरी रहती है दैट इज कॉल्ड एज अ इंटरनल थोरेसिक आर्टरी. सो मिडियल पार्ट ऑफ द मैमरी ग्लैंड इज सप्लाइड बाय दिस इंटरनल थोरेसिक आर्टरी, ओके. फिर लैटरल साइड इज सप्लाइड बाय दिस लैटरल थोरेसिक आर्टरी that supplies the latter part of the mammary gland. Upper part is mainly supplied by the thoracoacromial artery, उसके pectoral branches, and the superior thoracic artery, it also gives the branches. Then lowermost and lateralmost part is supplied by the posterior intercostal arteries. So these are the main vessels or arteries supplying the mammary gland. So it is mainly supplied by lateral thoracic artery which lies laterally, internal mammary artery which lies medially, lateral branches of posterior intercostal arteries, pectoral branches of thoracoacromial artery, and superior thoracic artery. Out of these, lateral thoracic, thoracoacromial artery and superior thoracic artery is a branch of axillary artery. So here it may ask in the MCQ, following are the branches of axillary artery which supplies the mammary gland. इसमें internal mammary arteries, though it supplies to the mammary gland, it is not a branch of axillary artery. ये MCQ में पूछा जा सकता है. वेनस ड्रेनेज में कुछ ज़्यादा इंपॉर्टेंट नहीं है. सुपरफिशियल वेन एंड डीप वेन. सुपरफिशियल वेन इंटरनल थोरेसिक वेन में जाती है, डीप वेन एक्सिलरी एंड पोस्टीरियर इंटरकॉस्टल वेन्स में जाती है. सो दीज आर द नेम्स अलॉन्ग विद द सेम आर्टरीज दैट वी हैव सीन अबव. अब आता है इनर्वेशंस, नर्व सप्लाई. स्किन ओवर द मैमरी ग्लैंड इज सप्लाइड बाय 2 to 6 इंटरकॉस्टल नर्व, ओके, थ्रू एंटीरियर एंड लैटरल क्यूटेनस ब्रांचेस. So these are the anterior and these are the lateral cutaneous branches. Lymphatic drainage, it is separately asked as a short note, very very important from your exam point of view and clinical practice point of view also. Now बॉडी में कोई भी लिम्फेटिक टिश्यू का अगर हमें ड्रेनेज देखना है तो वो दो पार्ट में आता है. एक लिम्फेटिक्स और वेसल्स, लिम्फ वेसल्स, और दूसरा आता है लिम्फ नोड, ओके. तो लिम्फेटिक वेसल्स में आता है सुपरफिशियल लिम्फेटिक वेसल्स एंड डीप लिम्फेटिक वेसल्स. तो सुपरफिशियल लिम्फेटिक वेसल्स जो सुपरफिशियल पार्ट ऑफ मैमरी ग्लैंड है, स्किन को कैरी करती है, वहाँ का ड्रेनेज करती है, एक्सेप्ट निप्पल एंड एरियोला. ऑल द स्किन ओवर द मैमरी ग्लैंड एक्सेप्ट निप्पल एंड एरियोला आर ड्रेन्ड बाय सुपरफिशियल ग्रुप ऑफ लिम्फेटिक वेसल्स. डीप लिम्फेटिक्स ड्रेन्स द निप्पल, areola plus parenchyma of the breast, rest of the part of the breast structure. So parenchyma, nipple and areola are drained by the deep lymphatics, okay. From these lymphatics it goes to the lymph nodes, okay. So how this lymphatics goes, there forms a subareolar plexus of Sapi, subareolar plexus which lies beneath the areola. There is a lymphatic plexus, and from this lymph vessels drains the areola into the anterior group of axillary lymph nodes, okay. Now the lymph nodes which are drained by the breast are the first one is the axillary group of lymph nodes which carries 75% of lymphatic drainage. In the axilla there are the lateral group of lymph nodes, there are the anterior group and posterior group of lymph nodes, then central, and then the apical group of lymph nodes. So these are the few group of lymph nodes lies in the axilla. Anterior group of lymph nodes at the anterior wall of axilla, posterior group are the posterior wall of axilla, central and apical are in the armpit apex level group of lymph nodes, and lateral was the lateral wall of the axilla. Few lymphatics are drained into the supraclavicular group of lymph nodes. From this axillary group of lymph nodes are mainly apical and central to the supraclavicular group of lymph nodes. Behind the sternum, medial to the mammary gland, they are drained by the internal mammary nodes. These two nodes opposite side get communicated with each other, and that will help or that leads to the spreading of the carcinoma from right side of mammary gland to the left side of the mammary gland. Few group of lymph nodes directly drains into the below the diaphragm, that is called as subdiaphragmatic or subperitoneal group of lymph nodes. Okay, and from there this transcenomically or through the peritoneum they goes to the ovary and causes the tumor of the ovary, that is called as the Krokenberg tumor. So in lymphatic drainage हमने देखा सुपरफिशियल लिम्फेटिक वेसल, उसमें सुपरफिशियल एंड डीप लिम्फेटिक्स वो कौन से एरिया को ड्रेन करता है. फिर हमने देखा लिम्फेटिक वेसल सब एरियर प्लेक्सस ऑफ द सेपी, और फिर देखा हमने लिम्फ नोड्स, उसमें आता है एक्सिलरी लिम्फ नोड्स, उसके सब ग्रुप्स इंटरनल मेमोरी ग्रुप ऑफ लिम्फ नोड्स, पोस्टीरियर इंटरकोस्टल ग्रुप ऑफ लिम्फ नोड्स that goes towards the posterior intercostal vessels to the vertebral vessels or towards the vertebra. Subdiaphragmatic or subperitoneal group of lymph nodes, they passes from the lower medial quadrant of the breast to the abdominal cavity, and they drains into the abdominal cavity and transcenomically can go to the ovary, causes the tumor of the ovary. फिर आता है apical group of lymph nodes that drains furtherly into the supraclavicular group of lymph nodes and the rotor's lymph node. ये एक MCQ में पूछा जाता है. What is rotor's lymph node? It is a lymph node which lies between the pectoralis major and the pectoralis minor, interpectoral group of lymph nodes, rotor's lymph node. ये MCQ में पूछा जाता है. Then this is the about one classification of the lymphatic drainage. Then now what previously mammary gland is divided into 4 quadrants. यहाँ पे sternum आता है, upper medial, lower medial, upper outer axillary of space and lower outer. But nowadays this quadrant system is not followed. The another system is followed, that is called as surgical axillary group of lymph nodes. They are according to the pectoralis minor. They are divided into below the pectoralis minor level 1 of group of lymph nodes, behind the pectoralis minor level 2 of group of lymph nodes, and above the pectoralis minor level 3 of group of lymph nodes. And superficial lymphatics of the breast of one side can communicate the opposite side also. Okay, so this is surgical. Whenever there is a lymphatic drainage question, you have to write lymphatic superficial and deep lymph nodes. फिर आपको लिखना है lymph vessel, फिर superficial लिखना है वो कौन से, फिर deep lymphatics देखना है, एंड सब एरियर प्लेक्सस ऑफ सेपे लिखना है, डायग्राम ड्रॉ करनी है. लिम्फ नोड्स में आएगा तो आपको एक्सिलरी ग्रुप ऑफ लिम्फ नोड्स, इंटरनल मेमोरी, पोस्टीरियर इंटरकोस्टल, सब डायफ्रैग्मेटिक ग्रुप ऑफ लिम्फ नोड्स एंड रोटर्स ग्रुप ऑफ लिम्फ नोड्स, ये सारा लिखना है. एंड अपार्ट फ्रॉम दैट दिस सर्जिकल क्लासिफिकेशन ऑफ लिम्फ नोड्स ड्रेनिंग. तो ये कंप्लीट आंसर हुआ. ओके, नाउ नेक्स्ट पार्ट इज द डेवलपमेंट ऑफ द ब्रेस्ट. ये कम पूछा जाता है, रेयरली आस्क्ड, बट आपको पता होना चाहिए. बॉडी इज डेवलप फ्रॉम 3 स्ट्रक्चर्स. आउटर सरफेस ऑफ द बॉडी, स्किन एंड ऑल दिस appendages are they develop from ectoderm. Then the inner hollow structures of the body like GIT, respiratory tract, blood vessels, जहाँ जहाँ पे भी हॉल होने से कैविटी, they are developed from endoderm. And between these two, muscles, bones and rest of the tissue are developed from the mesoderm. So these are the 3 things: ectoderm, endoderm and mesoderm. Endoderm and mesoderm. Okay, so mammary gland में 2 पार्ट है. One is the skin and second either stroma or the parenchyma. The skin of the mammary gland is developed from the ectoderm mainly. Okay, and the stroma is developed from the mesoderm, that is fat, suspensory ligament. Okay, and glandular tissue is also ectodermal in origin. Now the development of the parenchyma. Parenchyma of the that is the glandular part of the mammary gland is developed from the ectoderm arising from the mammary ridge. So what is mammary ridge? Mammary ridge is, or mammary line or a milk line, is extends from the mid axillary line to the lower part mid inguinal line. In lower animal, this whole line is persist and they form the numerous pairs of the mammary gland. But in humans, there are only persist at the level of the pectoral region where they develop the mammary gland. Rest of the milk line of Schultz or a mammary ridge, rest of the disappear. Now the whatever the mammary ridge lies in the pectoral region, this mammary line get thin to form the mammary ridge. This mammary ridge this mammary ridge forms a depression that is called as a primary bud, and this depression is goes below the skin, and from it there develops these secondary buds, and these secondary buds grows number wise and also extends into the deeper tissue, and this forms this duct, and that is called as the lactiferous duct. In case of male and in case of prepubertal life, there are only lactiferous duct, there is no development of acini, and later on after puberty there develops the acini around this lactiferous duct in the nearby connective tissue or fat or stroma that is developed from the mesoderm. The stroma or the other framework is developed from the mesoderm, and the rest of the things are developed from the mammary ridge, which is developed from the ectoderm, and later on this depression is converted into a elevation, and that forms the nipple and the areola, and this is how the whole mammary gland is get developed. Okay, there are some congenital anomalies in the development. Athelia means there is absence of nipple. Amastia, that means there is a absence of the mammary gland. Polythelia means supernumerary nipple, and polymastia is supernumerary mammary gland. Athelia means absence of the nipple. अब mythologically में अर्जुन इज द वन हु इज हैविंग अथेलिया, ऐसे कहा जाता है, तो इसीलिए अर्जुन को कहा जाता है संपूर्ण पुरुष, कि उसमें फीमेल का काउंटर पार्ट नहीं है, सो देर इज़ नो निपल इन. तो निपल और मैमरी ग्लैंड जनरली डेवलप्स इन द फीमेल, एंड अर्जुन एक था जिसमें निपल्स ही नहीं थे, दैट्स वाई इसको संपूर्ण पुरुष कहा जाता है. नॉर्मली नेचुरली डेवलपमेंटली हमारे बॉडी में मेल एंड फीमेल के काउंटर पार्ट दोनों में रहते हैं. मेल में वो मेल के फीचर्स प्रोमिनेंट होंगे सेकेंडरी सेक्सुअल कैरेक्टरिस्टिक के हिसाब से, एंड फीमेल में फीमेल के. तो वजाइना इज प्रेजेंट इन बोथ मेल एंड फीमेल, बट इन वजाइना लेटर ऑन गेट्स रूडिमेंटरी, एंड वो पोस्टेटिक यूट्रिकल की तरह फॉर्म होगा, एंड ऑर्गन डेवलप्स इन द फीमेल. मैमरी ग्लैंड में वेल डेवलप मैमरी ग्लैंड फीमेल में रहते हैं, रूडिमेंटरी मेल में रहते हैं. इस तरह से हमेशा फंक्शनिंग रहता है. बट इन केस वेयर द complete nipple is absent over there, that condition is called as अथिलिया, जो अर्जुन को थी महाभारत में. ओके, ऐसा कहा जाता है. आई हैव हर्ड दैट. ओके, देन गायनेकोमेस्टिया, अनयूजुअल एनलार्जमेंट ऑफ मैमरी ग्लैंड इन मेल इज अ गायनेकोमेस्टिया. नाउ डेज उसके केसेस धीरे धीरे बढ़ रहे हैं बिकॉज ऑफ द सेडेंटरी लाइफ, मोर इनटेक ऑफ द फैट, एंड और जो काऊ और बफेलो में मिल्क प्रोडक्शन में जो ओवर यूज ऑफ ऑक्सीटोसिन हो रहा है, जिससे उस मिल्क इंजेक्शन से वो ऑक्सीटोसिन मेल्स में भी एक्ट कर रहा है, फीमेल में अर्ली प्यूबर्टी आ रही है, और मेल में गायनेकोमेस्टिया के केसेस बढ़ रहे हैं. तो दीज आर द प्रोबेबल रीज़न. सो केसेस धीरे धीरे बढ़ रहे हैं. Mastectomy means removal of the breast in case of carcinoma. Partial or complete removal of the breast is done. Now in the haploid part, after you have to write there are 4 haploids which are important in case of mammary gland. One is the CA breast or carcinoma of breast. Second is the fibroadenoma of breast. Okay, that is benign tumor of the mammary gland. Third one is the abscess in the breast. Fourth one is the gynecomastia. Okay, Fifth one is the plastic surgery done over the mammary gland, that is the breast augmentation and like this. Okay, सो दीज आर द फ्यू अप्लाइड. उनमें से सबसे इम्पॉर्टेंट है कार्सिनोमा ऑफ ब्रेस्ट. सो व्हाट इज द ब्रेस्ट कैंसर? इट इज़ अ मोस्ट कॉमन ट्यूमर इन फीमेल. मोस्ट कॉमन इंसिडेंस इज 14% ऑफ फीमेल एंड दैट इज द ह्यूज परसेंटेज. ओके, और इट ऑकर्स मेनली एट द एज बिटवीन द 40 to 60 ईयर्स ऑफ द एज. ये जो ब्रेस्ट कैंसर डेवलप होता है फीमेल में, दैट इज डेवलप फ्रॉम द इपिथेलियल सेल्स ऑफ लैक्टिफेरस डक्ट. तो मैमरी ग्लैंड का जो पैरेंकाइमा है जिसमें लैक्टिफेरस डक्ट है, उसके इपिथेलियम का ये कैंसर है मेनली. ओके, व्हाट आर द कॉजेस? देयर आर न्यूमरस कॉजेस. ओके, कुछ हेरिडिटरी है, जेनेटिक है, लाइफस्टाइल है, हाई इंटेक ऑफ कोलेस्टेरॉल है, दे आर लिंक विद द carcinoma of breast. Important is the features of the carcinoma of the breast. Whenever there is a carcinoma, it is also called as a malignant tumor. Okay, it spreads, so there is a presence of painless lump, painless swelling if feel in the carcinoma, if feel in the mammary gland, then it alerts some signs about the carcinoma. If the painless swelling is there, you have to consult the respective specialist for it. So presence of a painless lump is one of the feature. If that swelling or the lump is a fixed and immobile to the breast tissue, that is also one of the sign, because whenever breast tissue carcinoma extends over there, it goes to the deeper part, invades this loose alveolar tissue of retromammary space and fixed to the pectoral fascia. So that's why breast becomes fixed and immobile. Then there occurs retraction of the skin. Because of the carcinomatous tissue, skin is get retract. Normally the skin over the mammary gland is smooth. If it is puckered, it is retracted, or wrinkling at the some area is there, that is also the sign of the carcinoma. Retraction of the nipple is also a sign of the carcinoma. Then lymph nodes are enlarged. We have seen the lymphatic drainage. Tumors mainly spread either by lymphatic or through the blood vessel. Few tumors spread via the lymphatics, and the lymph nodes of the axillary get enlarged, matted, painless, irregular masses of the lymph node. Few get spread by the subdiaphragmatic lymph nodes to the transcoelomically to the ovary, and in the ovary there forms a tumor of the ovary, and that is called as Krokenberg tumor. Okay, any discharge from the nipple, normally at the age of lactating only there is a discharge from the nipple, or that is milk. But apart from that, if no lactating period, if there is a discharge from the nipple, that also alert us some sign. If it is a bloody discharge, then surely it has to be investigated. So these are the features of the carcinoma of the breast, that suggests the carcinoma of the breast. Investigation में सबसे important and most is the self examination for the symmetry. Both breasts should look same. There is no changes in the size, color of the skin, pigmentation, retraction of the skin, retraction of the nipple, any discharge from the nipple, and the palpation of the breast is important to feel any lump or the swelling over the nipple. This one simple examination can detect early cancer levels. So at the time of the bathing, generally this examination should be done by the female, that is called as the self examination. She has to look for the symmetry of the breast. She has to put or palpate with by fingers whole breast area wise, and see is there any palpable swelling or not. Okay, is there any painful or painless swelling is there, and axillary lymph nodes also has to be palpated for it, or in any palpation if you see any lump-like structure, that has to be investigated. Then the second is the X-ray picture of the mammary gland on lower cavity level is taken to detect the cancerous mass, and the definite diagnosis done by the fine needle aspiration cytology. that is done by the pathology over the histopathological examination of the tissue taken from the mammary gland to see the cancerous cells, and that is the 100% surety of the tumor of the mammary gland. Okay, so that is whole about the mammary gland breast cancer. What is fibroadenoma? It is nothing but the benign tumor of the mammary gland. It is a mobile smooth mass felt in the mammary gland, and as it is a benign tissue, only that swelling is removed. Whole mammary gland or partial mammary gland not need to be removed. Abscesses of the mammary gland more common in lactating age. This is big, okay, and that abscess is drained by incision and drainage, and where it is pus is removed. Gynecomastia, prominence of the breast in case of male is a gynecomastia plastic surgery branch, that is do some surgeries over the mammary gland for the increase the size of the breast or reduce the size of the breast, make the breast firmness or the loose. That are the different surgeries done by the plastic surgeon. Okay, so these are all applied part related to the mammary gland. So we have taken that what is the structure of the mammary gland. Okay, skin, stroma and the parenchyma, where the mammary gland is situated. Then what is the extent of the mammary gland, it is a which type of gland, what are the deep relations of the mammary gland. Then there is a blood supply of mammary gland, artery and vein, lymph nodes or lymphatic drainage of the mammary gland, nerve supply of mammary gland, development of mammary gland, and the applied part of the mammary gland. One more question asked in the mammary gland, that is the clinical history. So you have given some clinical history like a 40 or 55 years age of female, done a self examination, found a hard painless lump in the mammary gland in the upper outer quadrant, and then on examination there is loss of mobility, skin is puckered, retracted nipple. Okay, and on x-ray also found some metastasis to the different organs. Okay, so what is lump in the breast? It is carcinoma or the benign. Okay, why it is not, what is purely orange appearance, how this tumor spread to the vertebral column, brain or the ovary, and what that tumor called which spread to the ovary from the mammary gland, that is called as Krukemberg tumor, which is the most common site of the breast carcinoma. This like this questions are asked and you have to answer it. Such a question is asked for a short note, and every paper covers this question. 2 questions are asked on the clinical history. So this is whole about the mammary gland. तो दोस्तों ये एक बहुत इम्पॉर्टेंट टॉपिक है, आप थरोली इसको बुक में से पढ़िए, और जब भी आपको बुक पढ़ने के बाद लगे कि इस तरह से कैसे नोट्स बनाने हैं, कौन से टॉपिक्स कवर करने हैं, तो मेरे इस वीडियो को आप रेफ़र कर सकते हो। तो दोस्तों अगर आपको ये वीडियो अच्छा लगा तो आप आपके कलीग्स, दोस्त, फ्रेंड्स, फैमिली में इस चैनल को, इस वीडियो को शेयर करो, और मेरे चैनल को लाइक, शेयर और सब्सक्राइब ज़रूर करना। थैंक यू वेरी मच।